Traditional physical therapy is a giant waste of time. In many situations, it makes the injury a lot worse, yet it becomes the most prescribed injury treatment method out there. In this video, I got a great question from somebody on Instagram where I broke down why traditional physical therapy isn't solving your problem and why you should avoid it. What's up, everybody? Dr. Matt Maggio here, creator of the Peak Method, founder of the Soft Tissue Revolution, and we're on a hell of a mission to make chronic injuries obsolete by helping people that are injured and in pain get properly educated and informed on their injuries and access to quality soft tissue treatments so they can avoid bigger problems down the road, like pain pills, injections, and surgeries, which only make things worse. All right, back at it for Ask the Doc, one of my favorite segments. So let me pull it up here. I got Amber. She's 32 from the Instagram. I watched one of your older videos where you talked about physical therapy being a giant waste of time, and I must say, I'm starting to agree with that idea. I'm on week 6 of PT for shoulder bursitis, and it doesn't seem to be doing much of anything, and sometimes the exercises make it worse. But my PT says, no pain, no gain. And that it's a good sign because the muscles are starting to work again. Not sure if PT is right for me and would appreciate your honest opinion. Thanks. Amber, thank you so much for that question. I want to give a little disclaimer before I go, especially people that see this on Instagram or YouTube and all that. I call you people, and I'm calling people out specifically, you Instagram doctors out there, and you see this all the time. Usually they have things in their name like mobility or WOD or something like that. Like they're going to show you how to do your own physical therapy, your own exercise on that. Those people don't have a clue of what's going on. And if you're getting your information from somebody that is a self-proclaimed guru or expert on the internet, they're not going to be able to help solve their problem because you got to get a thorough explanation about what's going on. So let's break this down just a little bit. First off, bursitis. I talk about bursitis all the time. Bursitis is just code word for the doctor has no freaking clue about what's going on. It says, when you break down the meaning of that, it basically just says there's inflammation in the bursa. So it's like, okay, does that really tell me anything? One thing that I always try to train in the practitioners that I work with and that are trained in the Peak Method, they're the best in the world at what they do. Very good shout out to them. But basically, I always train that you must have a tissue-specific problem of what's going on. And that has to be either a bone problem, a cartilage problem, a problem with the disc, a problem with the ligament, a problem with the nerve, problem with the tissue, or a problem with the tendon. And what happens is that doesn't really tell us that. Whenever you have an itis on there, it just means they don't really know. So it's like the question we have to get to is why do you have bursitis? And no one wants to answer that question. What we run into in the medical model is that like we want to just try to get rid of the symptom. We never get to the root cause of what's going on. And that happens by actually asking questions and thinking about it. What you're seeing in so much treatment out there in the medical world is that everybody diagnoses and treats based off what you're trained in instead of what you actually need. So physical therapists, they're going to be looking for things like weakness, tightness. Chiropractors are going to say your bone's out of place. Orthopedic surgeon's going to try to find some way to inject you full of cortisone and make sure they can do surgery. That's what's going on. And what happens is we try to do this cookie cutter approach for everyone out there, but every situation is different. So you must get to the root cause of what's going on. Now, here's the thing. A lot of times what happens is a lot of these problems begin with a tissue problem. What that tissue problem in most cases is actually an accumulation of scar tissue. So think of scar tissue as like glue that gets inside the muscle. I know I talk about scar tissue all the time, but it is a big problem. It is a number one cause for pain, decreased flexibility, and weakness, yet it is vastly misdiagnosed and not treated by anybody else. So what happens over time is you overwork your muscles. You know, you're probably sitting there watching this down on your phone in like some horrible position, or you go to the gym, you just do too much, or you don't do nothing at all. And what happens is those muscles don't get enough blood and oxygen. When they don't get enough blood and oxygen, it lays down scar tissue. That scar tissue is like glue that gets in there, makes it really hard for the muscle to stretch and contract. Over time, what it does is it puts more pressure on different areas in the body, maybe on the joint in the shoulder, on the cartilage, on the disc in the neck, on the tendon. So by the time you're having pain, it's already been overloaded over time. So what happens is we try to really simplify it. We go, okay, well that muscle's tight and it's weak. So we need to stretch it and we need to get it stronger. And that's what the traditional physical therapists do. they don't really start to critically think about what's going on. And this is why it's not working. So yes, you do need to have those muscles more flexible, and you also need them to be stronger. But an exercise and stretch isn't going to do that. Think of the scar tissue that builds up as like plaque that gets on your teeth, and eventually there's a cavity in there. So stretching, exercise, foam rolling, mobility, it's kind of like brushing and flossing your teeth. It helps prevent cavities, but you already have a cavity at this point because you have pain, you have dysfunction in there. So what you really need is someone to go in there and drill out that cavity. And that's what soft tissue practitioners are doing. That's what people trained in my method do. They're able to get in there very specific and very focused with their hands and the use of an instrument and break that scar tissue down. So the first step is you have to restore range of motion, and that's by fixing the scar tissue. Then you can get in there and build the strength. So what happens with traditional physical therapy is it's like they're trying to put the roof and the siding on before they ever lay the foundation. So any injury, and this isn't me just being a shameless plug about getting soft tissue treatment, you have to start with soft tissue treatment. And what happens is nobody agrees in the medical world. They're all like, well, mine's the best and this does this and this person does this. It's like there's a team effort from where you go. A lot of times when you're building a house, you have the foundation person, then this person, then this person. We need to do that in healthcare. And the first people you need to see is a peak method trained practitioner, because they can figure out exactly where that problem is, what's causing that weakness, what's causing that decreased flexibility, and what's causing that pain. And access to them is all listed down below wherever you're consuming this content. So yeah, traditional physical therapy is a giant waste of time until you get that scar tissue fixed. So don't fall for all these Instagram gurus and people that tell you can fix your problem with an exercise and more strength training and stuff like that. You have to get the tissue fixed first. And this is what's happening to, I forgot what her name was, with the bursitis and why PT isn't working. So you're taking yourself through these motions that aren't actually optimal, and it's putting more pressure on there. You got to get the tissue cleaned up first. That is the first step, and there should be no negotiation about that. But then what you run into is all the physical therapists, they like to bash people that use their hands because they don't want to use their hands. So they don't like me, and I really don't care if you don't like me. It makes me happy when you don't like me. I love to, kind of rile you up a little bit and stir the pot a little bit. But this is what's happening, and this is why people aren't getting better and why physical therapy is making it worse, because you have to get the tissue healthy first. And the only way to get your tissue healthy is go to somebody that uses their hands. They're really good at it. They can go in there and break that scar tissue down. Then if you need strength and more movement, the physical therapist comes in, but we all got to play nice and stay in our role. What happens is everyone wants to come in a little bit earlier. So thank you so much for that question. If you enjoy these videos or you have any topics you want me to cover, send me a message. I am always here to help, and share this with someone else that you know can help. And if you're a physical therapist and you don't like me, then that's totally fine too. I don't like you either, but it's okay. But we do need to eventually learn to all get along and stay in our lane and follow the order of operations and fix people, because it's going to help everyone get to the next level. So appreciate you guys, and I'll see you on the next one. Bye.